Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I'm excited to welcome board-certified family practitioner, Dr. Bryan Hoffman. Thank you for joining us today, Dr. Hoffman. So why don't you share a bit about your background, med school education, where you practice?
I'm from Dallas, Texas. I was born and raised and live there now with my wife and my 2 children. I went to medical school up in Missouri, in Kansas City. It's called University of Health Sciences, College of Osteopathic Medicine. Graduated in 1999. Came back to Texas, did my residency in Fort Worth at John Peter Smith Hospital, county hospital there, and then opened up and practiced with my father after that.
So as an osteopathic physician, you were trained to look at the whole person, correct?
Exactly. I mean, my dad's a DO and followed in his footsteps and always trained to kind of look at the whole body as a functional unit, and you know, that's really got me really excited about integrative medicine.
So when were you introduced to the field of integrative functional anti-aging medicine?
Back in 2016, actually was going through a transition in my practice anyway, and I was trying to, you know, look at different ways of treating patients. And ironically, the first time that I was introduced to integrative medicine was on my birthday. So it's kind of like a moment of change, so to speak.
So is there a backstory?
Not really, you know, just, you know, I went to a conference on my birthday, and, you know, it was one of those weird things where, you know, you're by yourself and you're making change, and you kind of look at, you know, reflect and kind of soul searching and look at all the things, and just happened to be on my birthday, so.
So what was the inspiration behind wanting to make a change?
To be honest with you, just the results I was having with, or the lack of results I was having with patients. You know, I wanted to find different ways of treating patients and, you know, getting positive results. What
were some of the issues that you were finding frustration with?
Well, as a primary care physician, you know, I treated a lot of diabetes and hypertension and obesity, and just with the conventional treatment, so to speak, patients weren't improving, and, you know, they're coming back every 3 months and still no improvement, in fact getting worse, and I'm like, I have to find different ways to treat patients, and that was actually one of the main reasons why I pursued it, is like, there's got to be something else out there to help patients.
So what was your original approach at that time?
It's a traditional approach of, you know, trying to manage their lifestyle and diets. However, I found that most patients weren't engaged in their own health, and all they wanted was another prescription to treat their problem, and I mean, we all know that doesn't fix the problem.
And I can assume that many patients get disappointed if they don't leave with a prescription or a magic pill to make them better.
Well, and also the disappointment is in, you know, they get upset that they're not getting better, but again, they weren't taking an active role in their health care, and, you know, playing the blame game, so to speak, and, you know, it's taxing, you know, being in primary care sometimes.
So when you found A4M, did you start the fellowship right away with Module 1?
So I actually took some time to kind of go through and look at, you know, my options, and then went to the spring congress in Hollywood, Florida, and after that is when I started the fellowship program.
So how long did it take you?
I actually finished it in 6 months.
Oh, wow. So you're the record holder.
Yeah, you know, so one of the reasons why I chose the program, because it was self-study, and at that time I was going through a transition. I sold my practice, and, you know, I really devoted myself to going through this transition period, and I was like, okay, what's the best way or the quickest way to learn the information I need to learn? And with it being a self-study program, you know, and I wasn't working full-time, you know, the days that I wasn't working, you know, I was studying. You know, I was sitting in front of the computer and going through all the different modules, and, you know, I'd start with Module 1 and then Module 2, and, you know, figuring out that, you know, each module took me about 2 weeks to get through on the computer. So.
So I know it's been a while since you were in med school, but how do you feel this curriculum differs from what you learned back then?
It's definitely a lot different. In medical school, a lot of these things you learn in medical school you didn't think you'd ever use again. And here I am now bringing back a lot of the biochemistry and the physiology, all the things that I thought I would just learn from medical school and then kind of forget. It's kind of bringing it back and realizing, wow, this is probably more important than you really think.
So now that you've completed the fellowship, are you interested in pursuing some of the other coursework, like the Peptide Certification?
Yeah, I've looked into some of the peptide courses, and I really need to establish what I'm going to do in my practice before I start. I don't want to get overwhelmed, so to speak. I mean, there's so much you can learn, and I mean, it's funny because one of the people that I work with right now, she says I'm like a sponge, just trying to learn things. And to be honest, every day, if I'm at work or I'm at home, I'm reading something, I'm watching a webinar. If I'm driving to work in my car, because I have a long commute, so if I'm driving to work, I'll listen to a webinar or a podcast just to maybe pick up that little tidbit of information. I've actually started applying it in some of my patients, and I got to be honest with you, I've had really good results. I'm pretty amazed, actually.
So can you share a story or two?
So your typical patients who come in with, hypertension, diabetes, and obesity, and they may have some, mild depression. I had this one lady who was always going to the doctor every month, and she ended up coming seeing me, obviously a complex patient. I started her on, autoimmune paleo type diet, recommended some supplements, recommended working on her gut health. And what was amazing is because she suffered from kidney stones, and she was in and out of the ER almost every month, with an attack. And so after about 3 to 6 months of treating her, she came in and she's like, started crying, and she was like, I want to thank you. I haven't been in the ER in 6 months because of everything you've done. And ironically, when she came in that day, she lost 20 pounds, and she didn't even realize she lost all the weight. And again, that was just a matter of just, fixing the imbalances that, we talk about here.
How gratifying and validating.
It is gratifying. I mean, when you go from the conventional world where your results are very limited. I mean, I've been practicing, family practice for 16 years, and I can probably count on one hand all my diabetics who've actually improved with my recommendations, and then here in just a very short period of time, I've had better results and quicker results with a lot of these patients.
So much of the patient's success is due to their compliance and the time that you spend educating them. So can you speak about the differences between this approach versus the traditional office visit?
Yeah, I mean, I've always taken my time with the complex patients, but you have to figure out which patients who are really interested in making a difference. And at this point I had to be somewhat selective because some patients just won't really buy into making the lifestyle changes. But the ones who do, have had a big improvement in their quality of life.
So being that you're still in the early stages of transitioning your practice, can you share with us how exactly you're going about this? Perhaps the steps you've taken and where you are in the process?
So, I'm currently I've built a business plan, trying to figure out what services I'm going to provide, what patient population I'm going to treat. I've done my research on EMR systems, I've done my research on lab companies. The main thing that I need to do now is find a location where, I can open up the practice.
Will you be a solo practitioner?
So I'll be the only practitioner with probably 1 to 2 staff members, looking to add additional services down the road as I go through the fellowship training. You mentioned peptide therapy. That's definitely an interest of mine, but it does take some time to go through the training on that. I'm also going to go through the IV therapy program as well, later this year so I can bring that into my practice.
So, do you have any concerns about going from an insurance-based practice to a cash-based or fee-for-service practice?
Oh, definitely concerned. I mean, you always got to worry about, where you're going to be making money to at least keep a practice viable. In the beginning, I think I'm going to do more of a hybrid approach. Start with insurances and then try to transition into a cash-based practice. But we'll see how things go with that.
Have you experienced any criticism or pushback from your peers now that word's out that you're transitioning into an integrative practice?
Yeah, I do. I mean, I think after a while, if you take the time to kind of explain to them and explain the science, a lot of them really kind of understand it. I mean, I still have some friends who are, in the traditional mold, and maybe they haven't been as affected with the changes in healthcare as myself or a lot of primary care physicians have.
So now that you've come this far, what is your goal? Where do you see yourself and your practice going with this?
Well, that's a good question. Actually, the goal of my practice is actually to establish have a good balance of work-life balance. In my previous practice, as a primary care physician, I was working 12 hours a day, 5-6 days a week. Didn't really have much of a life outside of work. I always used to joke and say I was married to my practice, and that's part of the reason that led me to this decision is like I needed to find a better work-life balance. I want to be able to go to work and enjoy what I do, make a decent living, but be able to go home at a reasonable time and do the things I can do with my family.
So you are a family practitioner, so I assume that you treat children and teens as well as people up through their older senior years?
Well, I actually treat a lot of pediatrics, and I do a lot of ADHD and autism. And that was actually one of the other reasons why I pursued integrative medicine, because I got tired of just writing the stimulant medications, and I wanted to be able to offer alternatives to parents who didn't want to jump to those medications. And again, bringing the integrative aspect into it, the patients who have, or the parents who have followed those guidelines, the children have improved with the integrative measures.
So what do you see the most success with when treating ADHD? Would you say diet modification?
Definitely the diet is the big thing. Changing all the different foods, the gluten and the cow's milk, dairy and sugar, those are the big three.
So what makes A4M so unique from other medical associations is that you have a membership base which spans many specialties, like cardiology, OB-GYN, endocrinology, oncology, rheumatology, orthopedics, emergency, internal medicine, etc. So can you speak about this and how unique that is?
Yeah, I mean, definitely you have a lot of different backgrounds. What is nice, though, is that I think everybody's here for the same common goal, is, obviously to learn and to be able to apply that to their patients. And ultimately, why are we doing this? We're doing this because we want to get patients better. And unfortunately, conventional medicine has not shown that. So a lot of people are striving or are very hungry to learn this new information.
Well, thank you so much for joining us today, and best of luck with your new practice.
Thank you. I appreciate your time.